Assalamu alaikum and welcome to the Health Show.
I'm Dr. Iqbal.
And I'm Dr. Faraz.
This week we'll be talking to you about the C word.
Welcome brothers and sisters to today's Health Show. We hope you enjoyed the show on obesity last week. I know I did. I managed to get hold of one of those cookies at the end.
You lucky boy. Now this week on the Health Show we're going to be taking a look at an illness which often strikes fear into the hearts and minds of people when it's mentioned.
It's an illness that is responsible for the death of a massive 150,000 people every year in the UK.
Alhamdulillah, it's also an illness which has benefited from medical technology breakthroughs and we're able to detect far earlier and cure better than in the past.
It is sometimes referred to as the C word.
That's right, folks. You've probably all worked out that we're talking about nil other than cancer. That will be the focus of today's show.
As usual, we'll be opening up our phone lines later, so do have a think about what you'd like to ask us about cancer. And make sure you start tweeting us on Islam channel with #HealthShow.
Now with us today, we're fortunate to have a cancer specialist with us to discuss different topics regarding cancer. We have Dr Arafat Mirza, who's a specialist registrar in oncology, and he'll be answering your questions with regards to cancers, symptoms, and we'll be posing questions to him about what sort of symptoms and cancers are all about.
Thank you for joining us, Dr Mirza. We know that cancer has been around for centuries and centuries and it exists across all nations. But what actually is cancer?
بسم الله الرحمن الرحيم سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Thanks for having me here. Our human bodies are made up of organs, and organs have millions and billions of cells, which are tiny particles which can only be seen by the microscope, and all these cells together form organs. Now, one of the properties of these cells is to multiply and divide and grow in number. Now, the reason why you don't wake up one day and have a liver just sticking out is that there is also a counter action to that cells die as well. So that's an amazingly, it's a wonderful mechanism. In fact, it's still not completely known how that happens. Cells divide and cells die, and you maintain the weight and shape and size of the organ exactly the same throughout your life. Now, that's a fundamental function of these cells. Now in cancer, this thing goes wrong. So either the cells multiply uncontrollably and they don't listen to the signals from higher above that they should stop multiplying, or they don't die enough. So that's why you have some cells keep going, multiplying like a madness, and then you have a tumor, tumor is essentially a very vague term. It's just a bunch of cells together sticking out, and it's like a lump. So essentially, in summary, cancer is normal cells of the body going haywire, not listening to the signals, and just keep multiplying.
Okay, now, from what I understand, there are different types of tumours, because a cancer is a type of tumour. And I think there's meant to be the sort of better type and the not so good type. There's a malignant and benign. Yes,
like I said, tumor is a very vague term, and a lot of people use that, unfortunately, to suggest cancer, but it's not. So it's important to bear in mind, tumors are two types. One is benign. The word suggests benign, is not that harmful. Another is malignant. And the cancer, when we say cancer, it's a malignant tumor. Okay. A benign tumor is nothing but cells. The cells are normal in that. Cells, again, a lot of viewers might be aware of that. Cells are, as I said, microscopic structures, the fundamental structure and functional unit of the body. So the cells divide, but they're in control. So they go haywire a bit, but not completely out of control. So that's a benign tumor. So it's harmless, it doesn't spread, and generally doesn't cause much harm. But it can give problems when it grows in size. For example, some people have benign tumors of the breast, and breast may become a bit enlarged, and that might need cutting out, but not an urgent thing. It doesn't bother much. But on the other hand, cancer with the malignant tumors are cancers which go haywire, they can spread, they can kill. So I think we're talking about just the malignant tumors which are cancers to this. I think that's important. I think that's a good question to start off with.
Sure. Dr. Mirza, Many people may have come across about the roles of genetics and genes in cancers. Can you elaborate a bit more on that and for the purpose of today's topic?
Yes, cancer, to be honest, cancer is actually a genetic disease. So basically what happens is something goes wrong with the genes, and genes are parts of the cells that have all the signals and the messages how the body is going to function. So something goes wrong with that. Now I can tell in detail about why things go wrong a bit later perhaps, but essentially it's a genetic disease. Now, as soon as we mention genetic disease, people start thinking it's inherited, but that's not true. Only rarely cancers are inherited. So, you know, for example, cancers run in family, but that's only, for example, breast cancer, just 2% or 3% of cancers run in family. And that's a gene which has gone wrong in the parents, and that's inherited to the children. But any person who's got a cancer, they have something wrong in the genes, but that doesn't necessarily carry forward to the young ones. So I think that's basically it, the reality about cancer being a genetic disease.
Fantastic. Well, Jazakallah khair for that. We've got a short clip actually of a syndrome called Lynch syndrome. Let's find out a bit more about this condition.
Thousands of people could be walking around with a defective gene that massively increases their risk of bowel and other cancers. Yet most of them don't even know. It's a genetic condition called Lynch syndrome. Audrey Francis comes from a family with a huge number of cancers, particularly bowel cancer. Her mother died of it. Tests revealed that Lynch syndrome ran in the family and that Audrey had inherited the gene. That makes it very likely that she too will get bowel cancer. People with Lynch syndrome are facing a very high risk of cancer, but without genetic testing, there's no way of knowing who they are. There may be as many as 100,000 people in this country, but we only know about 1 in 10 of them. And they're the only ones who get looked after. At genetic centres like this one in Newcastle, they're building a register of Lynch syndrome families and working on ways to protect them from cancer. Professor Sir John Byrne is a leading geneticist and an expert on Lynch syndrome.
If we find someone who carries the gene, first of all, we get them onto a surveillance program. The main cancer risk is in the bowel and in the womb in women. And we can check them on a regular basis, and we have it set up so that people come in every year or two to have their bowel checked and to have a gynae checkup in the clinic. And although they might still get a cancer, if it does happen, we'll catch it at an early stage and remove it.
Across the country, there are now 23 regional genetic centres where potential Lynch syndrome families can be investigated.
There's an interesting clip there on Lynch syndrome. So Lynch syndrome is a genetic condition which is related to predisposing you to cancers, and there are many other genetic conditions that which are related to various cancer forms. Now,
yes, I think Dr. Mirza was saying that breast is one of them, and I think this clip pointed out that this bowel type of tumour is also genetically related. But Dr. Mirza, we spoke a bit about the genetics, but surely there must be other sort of causative factors that can perhaps contribute towards cancer, sort of environmental factors, because I know there's genetics which plays a large role at times, and that's the underlying illness, but then there's other things that perhaps foods that we eat or things that we're exposed to in the environment that may make us more prone to getting cancers.
Yeah, I mean, as I'm saying, the fundamental reason for cancer is something going wrong with the genes, and there are hundreds of reasons why things can go wrong with genes. The commonest ones, I'll just list out, perhaps it's worth, I mean, we should be talking about that more because, I mean, some of them are modifiable. Some of them are not modifiable in that it's not in the hands of the people to change it, but it's a lot of risk factors, if you like, that cause a change in the genes can be modified. And the number one is smoking. I mean, we don't know the mechanism how exactly it causes problems with the genes, but smoking is known for at least half a century now, more than half a century, that it can cause cancers. And then you have alcohol, excess alcohol, and also diet. Again, diet, we don't have great data to conclusively say which ones cause what sort of cancer, but we've known from observational studies that that can cause. And obesity. Okay, the top four I would think are modifiable. So like fruits, we have pictures of fruits here. So eating lots of fruits has been shown to prevent bowel cancer, decrease the incidence of bowel cancer. So there are other causes which sometimes can't be really avoided. For example, sunshine, especially in white people over here in Europe, they have a decreased amount of melanin, the pigment that colors the skin. So they are more prone to catch skin cancer because of sun, and not something they can necessarily avoid. Of course, they can avoid excessive exposure to sun or going on tan beds, tanning beds. So that's one of the sort of, if you like, modifiable, maybe not modifiable. And then we have rare causes of cancer like genetic. Again, that's something they cannot modify. So yeah, I think I would say these are the common causes. And again, you have for lung cancer, you have asbestos, which is not a very common problem, but it's popular because people can have benefits. They can claim compensation from the government if they've been exposed to asbestos in the past. So I think that should suffice as the common causes of cancer from risk factor point of view.
No, Dr. Mirza, I mean, you've mentioned a fantastic amount of detail about the causes of different cancers, but cancer can affect nearly any part of the body. So I guess the treatment options for each of those cancers is different as well.
Yeah, exactly. I think one of the things to bear in mind is that anyone can have cancers, and people often ask me, why did it happen to me? And we have no answer. We know risk factors. Maybe someone smoked for all their life, but I can't say it's because you smoked, you had the cancer. I can never say that. No one, because only 10% of people who smoke get a cancer of the lung. You know, what happened to the 90% of the people? So anyway, so that's one thing to say about the cause as well. And treatment, of course, yes. I mean, treatment varies widely depending on the type of cancer. I mean, the three main types of treatments that oncologists, cancer specialists offer. Surgery being an important one, and then we have radiotherapy and then chemotherapy. So I don't know if you want me to go in detail about these things.
We have a short clip coming up actually on the surgical aspect of treating particularly liver cancer.
Yeah.
But in chemotherapy, just briefly explain about the options there.
Yeah. Chemotherapy is mainly used for, chemotherapy rarely completely gets rid of the cancer. It sort of is used as an adjunct to prevent recurrences. Somebody's had a surgery for bowel cancer, for example, and it is known to be of a type which is a slightly higher risk, then they get chemotherapy as an insurance policy to prevent the recurrence.
Okay, so they've had the surgery and then they've had the chemotherapy as an addition.
Exactly.
As an additional thing. Okay, I think we're going on to the clip now, folks, so we'll join you in just a moment.
Many people with cancer have to undergo surgery. Bowel cancer survivor Lynn Fallswood went to speak to Frank Meadows before he had surgery to remove the cancer that had formed in his liver.
What do you think about your chances with this operation?
Well, I had it explained. There are things that can go wrong, or can go wrong with it, but they don't expect things to go wrong. And they said there's no reason why you shouldn't live quite many years after this lot.
This is a major surgery taking place. This operation will take about 3 hours. The surgeon will make a cut in the abdomen and then dissect the veins, ducts and arteries from the liver so that he can remove the cancer. Merv Rees is a pioneer of modern liver surgery and one of the best liver surgeons in Britain.
Well, liver resection we started 25 years ago here, and at that time everybody felt that it would be a waste of time. But we now have nearly 2,000 patients that we've operated on, with a survival rate in all comers of between 40 and 50% at 5 years. And what is interesting, they then progress with survival to 10 years, which is not something we expected originally.
These days, the surgeons can use ultrasound to help them locate all the traces of cancer.
More and more people we can now help because we've got better at finding them. The techniques of surgery have got better. We've got better drugs from the oncologists that make some big lumps smaller that enable us to operate. So can everybody have this operation? No. It used to be 1 in 10, it's now half of the people, so it's 5 out of 10. And, you know, we haven't finished yet.
Surgery offers hope for many, and the success rate of this operation is just as high for people in their 60s and 70s, as well as those who are much younger.
We know that there is, unfortunately, a postcode lottery, as so-called, where some people in some areas are referred inappropriately, and in other areas that they're not referred at all. And I think if we could send a message out there to both patients and also doctors, because I think doctors have to take responsibility here to keep up with the literature and understand what can be achieved, because every patient would like to feel that they've looked under every stone and taken every opportunity that might be available to them.
So, Anna, it's amazing how the technological field has advanced, and in this day and age you can see doctors doing very complicated surgery to try and save people's lives.
Okay, so Dr. Mirza, with regards to cancers, we mentioned that it can affect any part of the body. Can you just let us know about what are the most common cancers that affect the population in the UK, or particularly the Muslim population here in the UK?
Yeah, it varies with the gender. In men, the top one is prostate cancer, the second is lung, and third is bowel. And in women, it's breast cancer, the top one, and then you have bowel cancer and then lung cancer. Bowel, lung cancer, similar incidence, if you like. So these are the top three.
So I guess the surprise one might be the prostate there, because I think everyone's heard of lung and bowel and breast, but it's not too often we hear the word prostate get thrown